that we really looked at the essential workforce and how to maintain that workforce, particularly at this time as we begin to get ready to reopen and have confidence in bringing our workforces back to work. And so we've put out a new guidance for essential healthcare workers.
Dr. Redfield, and we have questions for anyone on the panel, please.
Just a couple things to clarify. The 500 million masks the president mentioned that are being developed, are those for healthcare workers, or are you planning to actually hand out masks to the American public?
I think the focus has been to make sure that our healthcare workers and our healthcare system has the supply. And with regard to what we're gathering from literally around the world, and from manufacturers in the United States is first being deployed to states and to hospital systems. But I must tell you that whether it be the Haynes Company or other companies, we're seeing manufacturers in America that are recognizing the growing demand for masks by the American people, and are spinning up production literally by the hour. But our focus, our continuing focus, is on making sure that healthcare workers have the personal protective equipment to do their jobs safely and provide the level of care that every one of us would want.
Thank you, Mr. Vice President. Kansas Governor Laura Kelly says that she has put in 7 requests to FEMA for supplies from the stockpile, and those have not been fulfilled. So will Kansas be getting any of the ventilators, because the request included ventilators? And does she need to be calling the White House instead? Have you spoken with her directly?
I've not spoken to the governor directly, but I'll reach out this evening, certainly. In our conference call with governors this week, we spoke to them about the approach that we are taking. You know, traditionally, governors are accustomed to when a hurricane strikes the Gulf Coast, when wildfires strike out west, when flooding or tornadoes hit in places like Indiana. You're accustomed to have a declaration of emergency approved, and then resources flow from FEMA. In this situation, as we deal with a nationwide declaration and an epidemic, what we've explained to governors is that what President Trump has directed is that we leave no stone unturned to find resources around the country and around the world, including ventilators, and we make sure as the coronavirus epidemic impacts individual areas, that the healthcare workers and the families and the patients impacted have what they need when they need it. And what I would say to the people of Kansas is that we're looking at their numbers every day, just as in the case of every state in the country, and we're going to work our hearts out to make sure that as the coronavirus cases emerge, and we hope that through the great work that Kansas has done, on social distancing and mitigation. The people of Kansas have done a remarkable job. That we may well be to a place where their existing resources and capacities are present, but we want people to know that taking the counsel of Dr. Birx and our entire healthcare team, we're focusing, just as we did first in Seattle, California, and now in New York, New Jersey, Connecticut, Louisiana, the Detroit area, the Chicago area. We're going to make sure that those resources go in that order.
And sir, because you brought up social distancing and the work that Kansas has done, there's actually a controversy right now over her order to limit the number of people in religious gatherings to 10 people. Should states be telling religious institutions how many people can gather if it's to stop the spread of the coronavirus?
Well, the President's coronavirus guidelines for America ask every American to avoid any gathering of more than 10 people. And that's on the advice of all of our best scientific experts as a way that we can slow the spread. But as we've made clear to every governor, we defer to our governors in what they believe is the best and appropriate practice in their states, and we'll support those local decisions. Yes, please.
Thank you. In his opening statement, the president said there were 10 drugs that are now in clinical trials. Would hydroxychloroquine be one of those?
Well, I can speak to that, and then I'll invite Dr. Birx, Dr. Fauci to come forward. We do have, I believe, we will have roughly 4 separate clinical trials underway studying hydroxychloroquine. But it's important to remember that as the President's made the point many times, the FDA has approved what's called off-label use. And so in consulting with your physician, if your physician determines it's appropriate to write a prescription for hydrochloroquine, we're working today to make that available across the country. It's broadly available today as an anti-malaria medication, but we're working around the country and internationally to increase that supply. But we are studying it in at least 4 different clinical trials, and Dr. Fauci can speak to that.
So the easiest, thank you for that question. The easiest way to find out is to just go clinicaltrials.gov, and it will tell you everything that's there. There are a number of different clinical trials, some of which are randomized controlled trials, which, as I've said many times from this podium, to me is the optimal way to determine ultimately if something is safe and effective and works. But there are a lot of different ways that that's being looked at. It's being looked at against the placebo. It's being part of a
Next, please.
I want to turn back to the disproportionate rates of Black deaths when it comes to the coronavirus. Dr. Fauci, you have been talking about this for weeks, that there are underlying health issues. People with underlying health issues are most at risk. But if we knew that Blacks disproportionately have fallen into that category, why wasn't the CDC prepared to gather this data in real time to work to fight this?
Well, I'm not sure. Well, we have the director of the CDC here who could answer that question, but let me try to just take it from a different perspective. The health disparities that exist are not anything that started with coronavirus. They were there. So there isn't much you can do about the disparity. The thing you can do is to make an extra special effort to protect people who have, and to also protect them from inadvertently and innocently bringing the infection population for population of these underlying conditions. So the best weapon we have right now is what I said in my opening remarks, is to do whatever we can to get them to realize that what we need to do is to protect them from getting infected and to also protect